Hi, I'm Dr. Larry Burchett. I'm coming to you from Madera, California in the Central Valley, and I have a story where I think last night we have discovered that we were in the middle of a West Nile outbreak in the Central Valley. So last night I worked a night shift from 7 p.m. until 7 a.m. and I noticed that we had numerous, maybe 5 to 7 patients who came in with a flu-like illness. Fever, headache, body aches. In flu season, that might not be so interesting, but in the middle of the summer, it makes you ask the question, what's going on? Why are people coming in with a flu-like illness in the middle of the summer? And it wasn't until one of the nurses, the nurse manager actually, the charge nurse, said that she noticed that so many of these patients had bug bites along with their fever. That got really curious. So let's talk about West Nile virus for a minute. We know what influenza is, right? It's a virus that's spread from respiratory droplets from person to person. It's very infectious, and it can make you miserable. I think of West Nile virus as a flu-like virus, very similar to influenza, except instead of being spread person to person, it's spread through mosquitoes to people. So an infected mosquito bites you and gives you the virus like that. Kind of crazy, right? That vector goes through another organism to spread the disease. There's no specific treatment. There's no antibacterials, antibiotics, antivirals to treat this. So we recommend just Tylenol, ibuprofen, supportive care when needed. Now, some people can get really sick with meningitis and central nervous system encephalitis and more severe problems with this. Some of the patients that I saw had a headache and made me start to think, do they have meningitis? Are we starting to see some of these complications of West Nile virus? I don't think this is anything to really be alarmed about. Like flu season, this will probably come and go. But the number of patients that I saw last night, I anticipate that this may be an outbreak that you're probably going to hear more about in the news media. Thought I would share that story with you today. Now, to actually confirm the diagnosis, you would need blood work and other things to kind of prove it to public health that is indeed what's going on. But if you look in the news, the local public health has been tracking these mosquitoes and has been finding, I think there was something like 46 documented mosquitoes that had West Nile virus in there. So we know it's in there. And it just makes sense from what I saw last night. So many people out of the ordinary in the middle of July having a flu-like syndrome with fever and headache and body ache and these things. I'm highly suspicious that this is indeed West Nile virus. This is not something I've actually seen or experienced before as a doctor. But there you go. There you have it. So there's kind of some interesting breaking news right out of the ER. In terms of preventing it, the main thing is don't get bit by mosquitoes. So wearing long clothing, staying out of where they are, using bug spray, that's going to be your best way to prevent getting this disease. Hope you enjoyed this one. Kind of an interesting thing that I think piece of news that is developing. Watch for it in the news, see what happens, see what comes of it. I would follow it at the CDC, California CDC, and then Public Health in Fresno. Thanks for watching. See you next time.